Coronavirus Alert Health Check. Thanks for joining us this week. I'm Stephanie Skurlock. We've got a lot to get into tonight as COVID cases continue to grow across the Mid-South. The medicine, Remdesivir, has been proven to shorten recovery time for people hospitalized with COVID-19. And earlier this week, we told you the Centers for Disease Control sent Arkansas enough of the drug to treat 50 patients.
That which is going to help our patients as they are perhaps having respiratory problems. They might be on a ventilator, they're hospitalized. This is designed to give relief and to hopefully speed a recovery.
Arkansas has 59 people hospitalized with COVID-19, but not all of them will qualify for Remdesivir. The health department decides which patients will get the drug, and Memphis recently got a shipment of the medicine as well. Joining us now with how it works and how it could help patients in Memphis is Dr. Stephen Threlkeld from Baptist Hospital. Good afternoon, Doctor. Dr. Baptist was the first hospital to get this drug. Can you tell us how much did you get, and how does it help COVID patients?
Thanks, Stephanie. Well, basically, we just got enough for the first patient. So it's a patient-by-patient acquisition through Vanderbilt, who is the central clearinghouse for Tennessee. So when you have a patient that qualifies for the drug, you need to apply for it with admittedly a short application to get the drug, and they ship it here for that patient.
Mm-hmm. How is a patient responding? And can you give us a little bit of information? I know you can't give us her name, but can you give us some information about her makeup as to how she qualified?
Sure. It's a middle-aged lady who is quite ill and has been both on the ventilator, the breathing machine, and also is receiving ECMO, the extracorporeal membrane oxygenation machine, which essentially is like an artificial lung. It oxygenates the blood outside of the body and brings it back. And so right now, because we're trying to be fair and give it to the people that are the sickest, really, and might have the most benefit, that's how she qualified, because she was very ill and also met some of the other criteria. She had not been sick for very long, less than 10 days. And that's important because people who've been sick for quite some time probably aren't going to get as much benefit out of any drug, that one likely included. And there was no major toxicity or problems with the kidneys or the liver. That's another rule out if you have significant disease in those two organ systems. So she qualified for that, has been on it now for 8 days, and is now, I'm glad to say, off ECMO and actually doing better from a respiratory standpoint. It's important that we can't say that that's because of the Remdesivir. Mm-hmm. It could have been from a number of factors. But we know that in some studies, in the largest study out, it was shown to decrease the duration of illness, and we hope it's having an effect.
Yeah. So this is an experimental drug still, but is it what we have to rely on until we do actually get a vaccine?
Certainly, it's certainly the drug, the potential drug with the best information right now. I think the ultimate best answer is indeed a vaccine. That's how we prevent the infection. No drug is perfect. Every drug can have side effects, and it's not going to work on everyone. And in fact, when you're holding it for the people who are the sickest to give in the first place, in some ways it's an unfair disadvantage to the medicine. Any medicine that I can think of is going to work better earlier in the course of the disease. So we're having to be fair, save it till it's a little bit later. We don't want to waste the few doses of this medication that we have on people who are going to get well anyway, obviously.
So since it's being doled out, I believe from Vanderbilt University is the central point for the entire state, do you all get it as you need it? Do you just call someone and say, hey, we need another batch of it?
That's exactly right. There's a very quick application process, and the person needs to meet those criteria so that we can give it out fairly with the limited supply that we have. And they respond very quickly, and to us, we had the drug the following day and late that evening after I talked to the folks there in Nashville.
All right. So it's no fear that there won't be some at a time when someone else needs it.
Well, I mean, there is limited supply, so we don't know if there are any more shipments coming. We don't know exactly how much of that supply has been tapped into at the moment. But basically, as we see a patient who qualifies and might benefit from the drug, we contact our folks at Vanderbilt, and it's been an easy process so far for us, certainly.
All right, Doctor, thank you so much for being with us this afternoon, and we will see you later.
You bet. Thanks.
Okay.